A shelf life or the expiry period is the time duration during which the product is required to be meet to the quality specifications. Shelf life is the period or time duration from manufacturing of the batch till the expiry. The time at which or after which the product does not meet the quality parameters is called as the expiry period. Generally, I have observed the expiry period of 2 years. It may be less or it may be more depending upon the formulation. Then in use stability period is also there for some of the formulations like reconstituted injectables and powder for oral suspensions and solutions. So once you open the container and mix it with the diluent or you start using it, that is called as in use shelf life. So there are two types of shelf lives. First is the product shelf life in the final container, and after opening the container, that is in use shelf life. Welcome dear viewers to this video on Schedule M amendment, final formulation shelf life. So Schedule M gives you the information through its amendment for the final formulation expiry or shelf life. The key change is no longer tied to the API shelf life, that is the final formulation shelf life is no longer tied to the API shelf life. This is the amendment. Now we'll understand the background. So under old Schedule M section 10.9, shelf life of the final formulation referred as FF or finished formulation, you can say for your understanding. The shelf life of the final formulation should not exceed that of the active pharmaceutical ingredient, that is API. Exact wording: only raw materials which have been released by the QC department, that is quality control department, and which are within their shelf life shall be used. It shall be ensured that shelf life of the formulation product shall not exceed with that of the active raw materials used. Purpose is to ensure safety and efficacy by limiting finished formulation shelf life based on the API stability. The simple meaning is that if your API is having 1 year of the shelf life remaining, you cannot use in the formulation with 2 years of shelf life. Then key amendment, that is revision or revised Schedule M clause 14.14. The restriction tying finished formulation shelf life to the API itself or API shelf life itself has been removed. New wordings are there as below. Only raw materials which have been released by the QC department and which are within their shelf life shall be used. Implication of this is that finished formulation shelf life can now be set independently of the API used. And what will be the practical implication? Shelf life of the final product can now be made based on the actual stability data and the stability study data available. Actual stability data of the finished formulation, accelerated and long-term stability studies as per the regulatory guidelines. So as you know that we perform the stability studies on the final formulation in the final packaging at different conditions like accelerated, intermediate and long-term. So based on that data, you can assign the shelf life. Manufacturers no longer need to shorten shelf life of the finished formulation just because an API has a shorter remaining shelf life. It provides flexibility in product planning, labeling and the inventory management. So summary points of this video are: final formulation shelf life is determined by the finished product stability, not the API shelf life. Encourage science-based decisions for the stability and quality assurance. Reduces unnecessary wastage and allows efficient supply chain management. Compliance requires robust stability studies to justify the shelf life. So this is regarding the revised Schedule M for the finished formulation shelf life. and it is linked with the API shelf life. As per my own understanding and as per my own experience, whatever I have learned in last 15 years, whenever we are using the APIs in the manufacturing of the formulations, we should try to use the APIs which have the shelf life more than the shelf life of the formulation or equal to the shelf life of the formulation. Also, if you are not going to link these two, then you should have the stability data of the formulations in which the near expiry API is used. Then only you can justify. And it will depend on case by case basis. Some APIs are itself stable, some are unstable. Some APIs degrade faster, some APIs and formulations degrade slower, or they have their own intrinsic stability. So it is the case by case basis scenario, and this guideline gives you some flexibility to assign the shelf life based on the actual stability data, and it removes the restriction of the API shelf life link with the formulation shelf life. I hope this video will help you to understand these things. And if you have any question queries, you can comment, you can mail me. I will try to answer. But whenever you are going to assign the shelf life, it is always and it is always should be based on the actual stability data. Thank you for watching the video.